than right now. We are one day closer to putting this all behind us. We were unfortunate in Orleans County to lose a neighbor yesterday, but we will get through this. It's COVID-19's world that we live in right now. But like I said, we are one day closer to putting all of this behind us. At this time, I'd like to introduce Paul Pettit, our health director, who has bravely led us through this terrible time. Paul?
Thank you, Chairman Johnson, and good afternoon, everybody. Again, my name is Paul Pettit. I'm the Public Health Director for Genesee and Orleans County. And we're here again on Friday afternoon doing our weekly Zoom update around COVID-19 response, again, for Genesee and Orleans County. And as we've been doing for probably the past 5 or 6 weeks now, we've been trying to come to you with these updates at least once a week in person so that we can share the most recent up-to-date activities of the week and also have a chance to dialogue with our media folks kind of in a group forum. And we hope that, again, the information that we're sharing is relevant and helpful to the residents of the counties, that it provides good information and factual information. We, again, provide these daily briefings that I know our media folks have done a great job of pushing that information on a regular basis, and we appreciate them partnering with us during this time to make sure that we're providing information to our residents, again, so that they can be informed. And, knowledge is power. And hopefully the knowledge that you're gaining, not only through other resources, but also through what we've been pushing out, is helpful to you as you make decisions to protect yourselves and your family. So again, we're going to do similar to what we've been doing the past few weeks, where I'll provide some situational updates, some general comments on some of the newer updates that have happened throughout the week. And then again, we can dialogue a little bit with some questions and answers. So again, I'd like to start by saying thank you. I said the same thing last week, but again, there's a lot of folks in our communities, friends, neighbors, families that are doing a great job of adhering to the guidelines and adhering to the recommendations for social distancing, for staying home, for wearing masks when they're out and about, and doing the right thing. They're following the guidelines as close as they can, and in doing that, they're protecting themselves and protecting their families. So again, thank you to the folks that are sacrificing during this time. Again, none of us want to be doing this. We all want to go back to some sense of normalcy and be able to go out and go to different activities and games and the grocery stores the way we used to, and just have large family gatherings. And we're all very hopeful that this time will be fleeting here and that we'll be able to get back to those type of activities. But in the meantime, again, we need folks to adhere and to practice these social distancing guidelines and work collaboratively. We've been saying it over and over again. We are in this together. We need everyone to do their part, even if it's painful and frustrating. The quicker and the more diligent we are about doing these activities and adhering to the guidelines, the quicker hopefully we can move through this time. As said by Chairman Johnson, I also want to again offer my condolences. We did lose 2 folks this week, one in Genesee County and one in Orleans County to COVID-19. And it's never easy to lose a loved one at any time, much less during a pandemic and a health emergency that we have going now. And, again, I just want to take a chance as a reminder that, whenever there's losses and illnesses related specifically to COVID-19, it should be a strong reminder to all of us that we need to do our part to protect others. We don't want to be part of the problem in perpetuating this outbreak and this pandemic to continue longer than it needs to. So, again, let's, do our best to protect others during this time. So, new cases. So I'm going to run through some data real quick and provide some updates. Again, these are reflective of 2 p.m. today. So in Genesee County, we received 5 new positive cases for COVID-19 for a total of 92 cases in Genesee County. 4 positive cases reside in Batavia and 1 resides in Pembroke. 1 individual is in their 20s, 1 in their 30s, 1 individual in their 50s, and another individual in their 60s, and the last in their 90s. So again, pretty well spread out over the age groups for the 5 positives today in Genesee County. 1 of the positive individuals was on quarantine prior to becoming symptomatic and testing positive. And 3 of the total cases of the The ones that are active right now are in the hospital. That's not necessarily the 5 new ones, but total active cases in Genesee County, 3 are hospitalized. In Orleans County, we have 8 new positive cases today. Again, that is 8 new positive cases, which brings the cases up in Orleans County to 43. Of the new positive cases, 7 are in Albion and 1 in the town of Ridgeway. We have 1 individual in their 50s, 2 individuals in their 60s, 2 in their 70s, and 3 in their 80s. 1 has recovered and has been released from mandatory isolation, and 4 of the active cases, again, of the total in Orleans County, are hospitalized. So 4 hospitalized from Orleans County. Contact tracing has begun for all the new cases that I just mentioned. Again, my epidemiology staff and nurses, again, hit these pretty aggressively. As soon as we get these positives in, they immediately start calling and trying to identify close contacts, and then they again reach out to them and place all of those folks who are close contacts under mandatory quarantine. So again, we're very aggressive, and we do this in a very timely manner. And we've been very effective, I believe, at containing those cases where we know there's direct contacts. If a person has been identified as a contact, again, they will be notified us. And again, they'll be swabbed if indicated. So again, once they're under quarantine, if they start to show symptoms, we do swab them through the health department. And as you note, with some of these reports we put out every day, some of these folks that were previously under quarantine become positive, which is, again, the purpose of the containment, and getting them under quarantine, because they were exposed and there's a high likelihood that they could become symptomatic and infected with COVID-19. Again, we continue to provide limited information, no more than what we do in the updates that I just put around, different information relative to these cases. Again, HIPAA is very important, and we're trying to balance public knowledge and information along with health protection. It's very important that we maintain the health and privacy of those that are dealing with any health issue, COVID-19 included. When and if there is a situation where we need to notify the public in general, as in general location at X store at X time, again, we received calls about this. Why aren't we doing this more frequently? And the answer is we haven't had to. We've been able to be very effective, again, in that case contacting process, and we haven't gotten to the point where we need to do one of those public notifications. If we need to, we will. If there's a time where we feel we haven't been able to identify the folks in close contacts effectively, we will be putting one of those notifications out. But again, that's only going to be if needed. So again, with the messaging on this, if you're experiencing any COVID-19 symptoms, stay home. We can't reiterate that enough. We do not want people out and about if they're symptomatic. We also know that there's a percentage of folks that are passing COVID-19 asymptomatically or with mild symptoms. So it's very important to stay tuned to your body and know if you're starting to feel any type of related health issues, and that you're staying home. You're calling your provider ahead of time and talking to them about your symptoms and possibly getting swabbed and tested for COVID-19. But remember, we want you folks and everyone in our communities to stay home if you're not feeling well, and to help protect others by doing your part. So some of the cumulative data and numbers to date in Genesee County, again, 92 positives. We've had 453 negatives. We have 45 people under mandatory isolation. Again, these are our positive cases. 105 under mandatory quarantine, 0 under precautionary quarantine, 2 reported deaths in Genesee County, and 45 recovered. Again, I want to highlight that last number again, 45 recovered. These are folks that have cleared. They are now back off of isolation, and we'd like to see, and we're glad to see that number continue to climb. Orleans County to date, 43 positive cases, 288 negative cases, 27 under mandatory isolation, 41 under mandatory quarantine, 0 under precautionary, 1 death as we reported this week, and 15 recovered. So again, 60 total recovered in Genesee and Orleans County. And then again, we do provide the age breakdown that is available. So again, I'm not going to read through all that, but that is there and gives a good snapshot of different demographics around age and who's being impacted with positive cases related to COVID-19. Again, our map is available. I'd encourage everybody to go take a look at that. We do update that daily when we update our numbers during the week. We do not update that on the weekend just due to the complexity of making sure it's accurate, which is first and foremost what we want to do with this. make sure the information that's coming out is accurate and as real time as possible. But again, that is there and available. And as you can see, we did add Wyoming County to that map this week. We've been working with them over the last week and a half about getting them on board with this. And, we got to the point where we're able to add them. So again, hopefully that gives a nice regional snapshot of what's going on around COVID-19 in Genesee, Orleans, and Wyoming County. Again, multiple layers there, so play around on the map. There's cumulative data, there's active data. I think it provides a pretty good understanding of currently where we're at locally within our communities. Again, if you look at the active tabs, especially on the charts, you can really see that, as we clear people on the back end and they become recovered, that we do see some semblance of a plateau a little bit on our active cases, which is a great sign. I'm not going to get ahead of myself and say we've hit the apex and we're where we need to be, but it is encouraging that we have somewhat plateaued for now, and it just reinforces the work that we've been doing and the continued need to continue practice social distancing. All right, some operational updates. Again, swabbing remains limited in our region. Unfortunately, we're still working daily to get additional swab kits, both in the health departments, but also with our providers in the community and our health systems. It is improving a little bit on the health system side. So we talked with them multiple times throughout the day and throughout the week. And they are getting in a position where they are having some additional swabbing capacity. It has not opened up to the place where we'd like it to be. As far as anybody wants to get swabbed, they can get swabbed, but we are seeing slight improvements there. So again, if you're needing to be swabbed, especially if you're in your high risk categories, again, the elderly, seniors, those that have underlying health conditions or severe immune system issues, those are the folks we're really focusing on still. But again, if you don't fit in those categories and you're presenting with COVID-19 symptoms, there's a higher potential likelihood that you can get swabbed at some of the healthcare system sites, specifically at UMMC and the tent city that they have there on Summit Street. And again, we do know, and we've heard as of today, actually, some more regional testing in Rochester and Buffalo, some private testing at Walmarts and some other locations. Again, we do not have any of those locally at the moment. We are reaching out and trying to figure out ways that we potentially could offer some of those type of testing opportunities locally within Genesee and Orleans County. Unfortunately, we have not been able to identify and to lock that down yet, but we are working on it. In the meantime, again, there's nothing that prohibits anybody from our counties to going to those locations and potentially getting swabbed. Again, there are criteria, you have to pre-register, et cetera. So follow the guidelines on that, but there are additional opportunities in the area potentially where you can get swabbed. So again, COVID-19 is circulating locally. As we've been seeing, there's widespread community spread throughout all three counties, including Wyoming. And again, we just can't stress enough how important it is for everyone to practice social distancing and take it seriously and stay home. It's your social and civic responsibility during this time to protect yourself and others. One thing I also wanted to talk about is, that there's some complaints coming in around folks that are being told that they're under quarantine or isolation. You got to remember, again, we are dealing with positive cases. Again, these are ones that are lab tested. We have heard many reports where people are saying they're positive, saying they're under quarantine. And this may be, again, from their primary care physician. Maybe a scenario where they weren't able to get swabbed due to maybe not fitting one of those high-risk categories. Maybe high likelihood you are positive, or you maybe have COVID. At minimum, you're ill with something. That's why you're symptomatic. But the reality is, we are getting some concerns about folks out and about, maybe working if they're ill, working if, again, they're positive or under quarantine. So we do, when we get those calls, we look in to make sure, they're not on our official list per se, but we really have no legitimate way to track community-based numbers and folks that may be self-quarantining or quarantining because of their primary care physician has put them under quarantine. But we just want to remind folks, there is guidelines out there that if you are an essential worker, so you meet those categories of jobs that need to be open. And again, there's the list that's provided on the state website. People are allowed to work if they are in quarantine, even under our own quarantine. There's specific guidelines that they have to meet. Obviously, number one, they have to be asymptomatic. They have to wear a mask while they're at work. They have to report additional temperature checks throughout the day. but they are allowed to work. So again, there's a balance here between protecting others and making sure that we can continue to move forward with essential operations, essential businesses. So just keep that in mind that, just because folks are under quarantine doesn't mean that they can't be out and about for various reasons. Again, working is the only legitimate one that we allow. When they're not at work, these folks that are under quarantine, they have to be home and they have to follow all the guidelines that everybody else does under quarantine. So just a little clarification on that. Also, just another reminder, we say this every week, but this can be very trying and difficult time for folks. So if you are experiencing any anxiety or any type of mental health or type issues, we want to make sure that you have an opportunity to reach out to somebody. We've been talking about this regularly. It's in our briefing every day. We feel it's very important that people know they're not alone, that you're not difficult or a challenge, or that you're off base for feeling the way that you're feeling. This type of situation can add stress to anybody. So make sure you reach out. There's a care and crisis helpline in our counties for anybody 24/7. Again, that the information is there provided, and I know it's up on the media. It does a good job of keeping this information out there. Our mental health departments, other behavioral health organizations within our communities are open and they're willing and able to talk to folks. So if you're feeling anxious, feeling alone, etc., depressed, make sure you're reaching out and talking to somebody. We don't need anybody, suffering needlessly in these areas. All right, so a few more just general updates, and then we can open it up for questions. So again, I know it's been widely talked about, and it is out there around the governor's new executive order about wearing face coverings, and that goes into effect tonight at 8 p.m. So again, that's tonight at 8 p.m. And, essentially whenever you're out in any public areas, if you're within 6 feet of anybody, you have to have a face covering on. And again, we're not talking about the N95 masks, the ones that medical personnel and those that actually protect you from the virus. We're talking, again, more of the common use surgical mask, and more importantly, just any type of cloth face covering. There's all kinds of templates and blueprints out there for folks to make their own. So those are things that we'd encourage people to do. Obviously, there's a shortage around, as we all know. So the likelihood of getting your hands on some store-bought ones are probably slim to none. So people are going to have to be creative. We've seen a lot of organizations, volunteers, people that just love to sew in our community step up and actually, start making these by the dozens and hundreds and thousands. And they're really available and out there. And I know they're donating them to a lot of people. So it is the guidance. It is the requirement that the governor has put in place, like it or not, I suppose, at this level. And the whole idea here is, again, to continue to slow the spread. As we've talked about many times in this forum, these masks are protecting others from you. They contain spit, spray, cough, sneeze, anything that's coming out of your mouth from being projected forward, which is protecting those that you're around. So again, when we look at the definition of a close contact for COVID-19, it's 6 feet or closer for a prolonged period of time. So again, these face coverings, when you're out and about, the whole goal here is to protect others from you. Because again, we know there's potentially asymptomatic spread of COVID-19. So even if you're not presenting symptoms, you potentially could be spreading it unbeknownst to yourself and to others. So again, we're asking folks to adhere to the guidelines. We all need to do our part, again, to try to move this through this time as quickly as we can. The other thing, obviously, we've been talking about is the governor did extend his disaster emergency through May 15th, and locally, both Genesee and Orleans County have extended their local state of emergencies through May 12th. So again, locally, both counties have extended their local state of emergency that was originally put in place in early March. Again, complaints around businesses. If you're a worker, if you're concerned about your business maybe not adhering to the guidelines, there is the ability to lodge complaints through the State Department of Labor. And then under New York State pause, there obviously is the mechanism for complaints potentially on businesses and or gatherings that may be occurring. So there's an outlet for folks to call. And again, that goes to Albany, to the state, and then back down to the locals to investigate and look at those different situations that may be occurring. Again, with the idea that hopefully through some conversations, we can come to some understanding and hopefully rectify those. So again, that's all I'm going to provide for my updates here today. So what we're going to do is I'm going to have the media unmuted at this time. So again, if you have questions, I'm happy to answer them at this time, and just state your name, and we'll hopefully be able to get you the answers you have. So
Paul J. Gazelle here, just a comment. Your daily report that you are putting out for both of our counties, the kind of things that you just wrapped up with, you have that information in those daily written reports that come with your being today live or every other day of the week, correct?
That is correct. Yep. Those all get blasted out to many different sources, and I know they're widely distributed. And again, hopefully they have information that's helpful to folks and provides the relevant situational updates.
Thank you.
Paul, this is Dan Fisher at WTA. Has the data you've received so far, albeit limited, given you any trends that you can spot, either positive or negative trends in the two-county area that would lead you to think that we have plateaued or perhaps even on the downside?
Well, as I talked about a little bit earlier, Dan, when I was going through the numbers, and I do believe that if you look at active cases, which is that key indicator, what I talked about, obviously our cumulative numbers keep going up and up because we're just adding to the pool, right? But when you look at the active cases, as we get folks who are recovered, it lowers down the amount that we're monitoring and tracking. So again, I think that's a good indicator of what's going on in our community as far as the prevalence, right? So the current number and level in our community. Again, I'm a little cautious to say we've plateaued, but if you look at the numbers, recently over the last week or so, you can see that our new cases are getting balanced out with those that have recovered. So again, I think we have a ways to go as far as cases coming along, but I'm very hopeful that we can do identification of these quickly through hopefully increased testing, and that we can lock these folks down, we can contain it, and again keep these little outbreak and clusters contained.
Paul, one more question. Of the 45 here in our county, 15 over in Orleans County, who have recovered, do you know if any of them have volunteered for the antibody testing? And if so, is there a statistic on that?
Unfortunately, I do not know if they have volunteered. That is just coming out now as far as, a lot of the antibody testing. And, unfortunately, we don't have a lot of good information locally on how to engage in that. We've been getting a lot of questions on that. We've been asking a lot of questions. Obviously, the governor has been talking about this on a daily basis this whole week. We're very hopeful that the antibody testing piece is going to be a very important tool for us in understanding potentially the number of folks who may have already had COVID-19 in our community that we weren't aware of. There is, information, I know on the antibody testing piece, they are starting to look for volunteers, healthcare workers specifically, that may like to volunteer potentially to be part of those studies. And again, as more information comes out on that, we will definitely make sure we release that through our briefings every day.
Do you have access to those tests, Paul?
We do not have access to any antibody tests locally in Genesee or Orleans County at this time.
Howard Owens with the particular. Are you done? Dan, are you done?
I'm done, Howard. I would never steal your limelight.
I'm not trying to steal yours. So, Paul, Dan had a good question and sort of a follow-up to that before I get to some of the other questions I had. Are you hearing anything about plasma donations from the people that are no longer active, and maybe to address what you know about how that might be helpful?
Yeah, so obviously there's discussion around plasma, right? So blood from those folks that may have already had COVID-19 and potentially have antibodies within the blood, and that being potentially as a transfer to other patients that may be dealing with COVID-19. Again, there's a lot of new emerging different studies and tests around this. We do not have anything locally. I know the Red Cross is, potentially starting to look for blood donations from folks who may have had COVID-19. Again, confirmed, they have to be lab confirmed, and then part of that so they know that there's some level of, potential antibodies there. And then obviously they would use that potentially to help others that may be dealing with illness. But more to come on that. This is obviously something that's promising around additional ways that we can continue to move through this crisis.
So, Paul, this is kind of touching on some issues you already addressed, but, like you, I continue to get contacted by people working for essential companies, essential employees, expressing concerns about what their employers are doing and their own safety. And just like you have legal constraints about how you can respond to things, I have legal constraints about what I can do with that information sometimes. So I wanted to just ask you, what is your advice to local managers, local business owners to not only ensure that their employees are safe, but to help them feel confident that they're safe?
Yeah, I mean, that's a great question. So, again, when we look in the community, especially these employers that have employees coming in, and I think, the recommendation around mask use specifically, the way it is coming in now and requiring any interaction with, public, I think that's going to help. But businesses can be more restrictive on their own too. I mean, we've encouraged a lot of places to put in place guidelines for any employees coming in that they do pre-screening. That potentially they're monitoring temperatures of folks when they come in. They're making sure that they're asking and talking to them about the importance of not being at work if they're symptomatic. That again, when they're in that environment, that they're continually washing their hands, that they're maintaining the 6-foot separation as best they can within the different work environments. And again, the mask, because again, if you're symptomatic, you can protect your other coworkers around from you, or if you're asymptomatic, protect those within that close environment sometimes. So again, I think there's some different level of engagement that employers can do. Again, if they have someone that's on quarantine, there's some additional steps that those folks have to take as far as temperature monitoring, et cetera. They have to have a mask on. So again, it depends on what level of engagement, but I think if an employer is taking a very proactive stance to protect their employees, there's definitely some ways through, these different measures I just talked about where they can be successful in doing that.
It seems like we've had a couple of hot spots, and I'm just curious, you may not be able to put a number on this or map this out for us, but what are you seeing potentially where new cases are related to a cluster of other cases, or are you seeing a lot of new cases that are potentially isolated from what you already knew about?
Yeah, it's kind of a mixed case. Again, even going back today, what I reported, for example, in Batavia or in Genesee County, 4 of the cases today of the 5, only one of them, 5 cases, only 1 was positive, was on quarantine before. So again, the other 4 would be new unrelated cases. They were not under quarantine. And same thing up here in Orleans County. There was, some of these folks were not under quarantine. So, some of these hotspots, again, we've been very successful. I firmly believe working with the different organizations to, again, put in place some of those measures to do screening, to provide PPE, to put in place different control measures to suppress different outbreaks within those organizations. And then also, again, it's kind of a twofold attack where our staff, our epi and nurses are very, again, aggressive and really work hard to contain those where we identify all those close contacts. So, I think it's still a bit of a mix. We've been able to kind of clamp down on those outbreaks and clusters where we're seeing some pop up. But again, we're still getting onesies and twosies from the community, which are unknown cases to us, which then, again, leads to that case contact and potentially sprawling a little bit more into new cases.
Thank you, Paul. I think this is my last question. One of those hot spots is the Batavia, the Buffalo Federal Detention Facility. There's 12 cases there now. How confident are you, or do you feel like they've been cooperating with your department and working well and helping to, sort of flatten the curve and keep things contained there?
Yeah, so like I mentioned before, any of our hotspots that we've had great success. The senior leadership and the administrators in these different facilities and businesses have been all very cooperative. I believe there's a great sense of wanting to make sure they're doing the right thing. Number one, to first and foremost protect their employees, to protect those that are within those organizations. And, I applaud the efforts that they've been making, particularly when we get in there and we find out there is some cases and some issues going on. And, again, although there are continuing cases in some levels in some of these places, it's not to the level where it may have been if there weren't, again, increased efforts and activities around suppressing some of these outbreaks. So I'm very pleased with the support and the work that management and administration has had in these type of organizations.
This is Mallory Diefenbach from the Batavia Daily News. Livingston County today revealed that they have identified a cluster amongst county employees and issued an exposure alert to the county health department. I was wondering how the health department for Genesee and Orleans is doing restaffing, protection. Do you guys have anyone that's being watched?
Yeah, so we would treat this like any other business, right? So county government's an organization, and none of us are immune to COVID-19. If anything, in my own personal opinion, in our health departments, we're hypersensitive to trying to make sure we keep COVID-19 out of our health departments, particularly because we need our folks for response activities. But again, any employee within our organization, it's a similar response. We work with county management and the HR and to look to contain and to do any case contacting if there was contacts within the department or within the community, at their household, et cetera. So again, the approach isn't any different. We would work particularly with whatever department the positive case would be, and again, identify folks where there may be contacts. Again, like with many other businesses in different areas out there, the county has done a great job of meeting the mandates. Again, the governor had a 50% reduction mandate, and I know for a fact the county's been doing well at maintaining those levels well below them, and also making sure that there's rotation on the different employees and the different departments, that folks are keeping 6 foot apart, obviously enhanced, hand washing, and obviously most of the buildings, if not all of them, are closed to the public. So again, limiting interactions, everything's gone more remotely. So again, I think there's a high heightened alert around protecting employees within the county ranks, but also protecting the public that may interact and need services from the county.
All right. So have you guys avoided having anyone in quarantine then?
Well, again, I'm not speaking about any specific cases relative to any operation, whether within private or the county. But again, the process doesn't change as far as what we need to do as far as making sure we contain and we put anybody under isolation or quarantine that may be positive or a direct contact.
Okay.
Paul, it's Tom Rivers with the Orleans Hub. You had mentioned on the testing, I just wonder how quick the turnaround is, if that's an issue as well when someone is tested. I think there's quite a gap is what I've heard.
Well, thanks for asking that, Tom. Actually, things have been improving in that area. We are actually this week been getting results back sometimes the next day, later that day, or most the following day. So, a couple of weeks ago, we were out sometimes 7, 10, 14 days with getting test results, which is ridiculous and frankly very challenging for us to work within an outbreak and trying to do containment. But this past week, we've seen a significant increase in turnaround time, which is very good. I think it's reflective of some more capacity starting to come online, and will be essential for us in being able to move forward and again, hopefully start opening things back up a little bit and trying to understand what's going on in our communities.
Yeah. If you
wasn't part of that process the fact that, like in the Erie County lab that we use, and even in the RGH system, in some cases they didn't have things like the reagents and some of the other testing components, so they could turn around and be as efficient and effective as possible.
Yeah, I mean, so lab capacity and testing capacity has been evolving, right? And early on, again, we were using state and county labs, and there was some issues with reagent and around capacity. And at this point, most of our swabbing, at least through the health department, is going through some of these reference labs, and it's just getting turned around really quick. And it's a good sign, and hopefully more of that to come.
If I could ask, with the quarantine, I would guess for some people it's actually hard to self-isolate in your house if you got a lot of bodies in that house. Mm-hmm. And I don't know if that's been an issue, and if there is a plan where maybe a hotel room or something for some of these people who just might not be able to pull off a quarantine.
Yeah, so I can speak to this real quick, Tom. So the first part of the process here is when we have someone, whether it's either quarantine or isolation, our nurses do an assessment of the home. So that's one of the first things they do to see if it is a viable location to quarantine or isolate someone. And, obviously who's in the household is one of the questions we look at. Again, if you're a positive case, we're concerned potentially if you're living with grandma and grandpa who, could be higher up in age and have multiple health issues. And, that could be a scenario where we want to try to avoid that. Again, one thing we're looking at is multiple bathrooms, because one of the biggest things we want to do is keep folks apart as much as possible. So social distancing within the house. So we do make an assessment and we look at these, living arrangements to make sure they're suitable. And we do have arrangements with other locations within the county and also in a neighboring county where we can house folks who may not be able to safely be quarantined or isolated at home. So that is part of the process where we have set those locations up that we can utilize if needed.
At this point, have you had to send anyone to an alternative site?
Fortunately, no. We've been able to work it out. Sometimes we've had a few cases where the initial primary residence we were looking at was not suitable, but a family member or another acquaintance stepped up where it was able, again, a situation where we could put the person. So fortunately, we've not had to utilize those systems. We've been able to keep people in their home or a familiar environment, which I think is very important, again, to help folks manage through this 14-day period.
And, if you did have to do it, I would guess maybe that would fall under that COVID line item where maybe that would be reimbursable if you had to do a hotel room.
Yeah, there's definitely funding streams. I mean, the health departments have grants that have been passed down through the CDC, obviously that are going towards overtime costs and other contractual expenses. And one of those is, obviously the support to house and care for folks that may be in isolation and quarantine.
All right. Thank you.
Yep.
Hey, Paul, this is Howard again. If you don't mind, I got one more question, but I also want to know, that's really interesting information that you have those alternative locations. I hadn't heard that before. This is a little more of a policy question, I guess, but I wanted to get your thoughts if we could. There's been a lot of chatter this week about reopening the economy. The president came out with his 3-point plan. He and Cuomo have kind of gone back and forth. Genesee County, it seems like we've had a higher prevalence of cases than a lot of other rural counties, and 6 yesterday, 5 more today. What, if you had a chance to advise the governor specifically how to approach the situation in Genesee County, what would you say about, opening up society, opening up the economy again? Are we ready for that yet, or how far away do you think we are, if you have any thoughts?
Well, I guess I would offer, number one, that, we're looking at things from a public health perspective. I'm not an elected official. I'm not one of the ones that's in charge of making those decisions. And I do believe that we need to make sure whatever we do is done out of a thoughtful process where we're, really taking health and safety at the first and foremost front end of things. The last thing we want to do is, get in a situation where we, roll things out too quickly and we open things up. And we get in a situation where we now have a second spike or a second wave in a rush of new cases. I think it's very important, number one, that we have lab capacity testing on the front end for positives and then also antibody testing on the back end for those that may have already had COVID-19. We need to understand the picture of what's going on in our communities. And to this date, as we've talked about many times, unfortunately, we don't. This is not an issue just in Genesee and Orleans County, but also throughout Western New York, Central New York, and around the country in different areas. So until we, have a full understanding of what's going on, I think it's very challenging to make decisions around opening things up. But again, I do believe that just like in the country, there's different, levels of activity in different states. The same thing is here in New York State. We're not all the same. We have bigger urban areas. We have a lot more activity downstate than we may have upstate in Western New York. So I think there needs to be good conversations around what's appropriate where and when and how we do that. And I think it's going to take, again, open, candid conversations and to do it safely and to do it in a way that, again, we can get things up and running and back to some sense of normalcy, but making sure that we're protecting folks as best we can as we do it.
Thank you.
Yep. Any other questions? Okay, well, we're going to wrap this up then. Again, I wish everybody a happy weekend here, that, be safe, go out there and practice your social distancing, gather from afar, and, be safe and healthy. And again, we'll continue to provide these updates throughout the week daily. And we'll be back here next Friday with, our in-person Zoom meeting. So again, take care, be safe and be healthy. Thanks.
Thanks, Paul.